So today I will talk about some of the common misconceptions which people who smoke cigarettes have. They ask me almost on a daily basis. So the first misconception or myth is that I am smoking only 1 to 2 cigarettes a day, so that is not a problem. So this is what many people tell. What we have to understand is that there is no safe limit for smoking cigarettes. Even 1 cigarette a day is harmful, and there are studies which have shown that people who smoked only 1 cigarette a day live 5 years lesser than people who have not smoked cigarettes. So the first misconception is that there is a safe limit to smoking cigarettes. So there is nothing called as a safe limit for smoking cigarettes. Even people who smoke 1 cigarette a day can develop lung cancer. So that is the first misconception or myth. Then the second misconception or myth is I have stopped smoking cigarettes, but I should not develop any problems because of smoking cigarettes in the past. So what happens is when people have smoked cigarettes for long time, 10 years, 20 years, and they stop smoking, what happens is the risk of developing lung problems like lung weakness, COPD, lung cancer will never go back to the baseline, will never go back to zero. So whatever cigarettes people have smoked, whatever nicotine, whatever tar which has gone inside will remain inside the lungs only. So even though you stop smoking cigarettes, the risk of developing lung problems would continue for the rest of their lives. That is the reason why we ask people not to start smoking cigarettes at all. We don't tell them not to stop. People have to stop, because if you don't stop smoking, the risk will be much higher. If you stop smoking, the risk will decrease a bit, but it will never go down to zero. So after stopping cigarettes also, the risk of developing lung cancer and risk of developing COPD would decrease, but it will never go back to zero. So many people who stopped smoking cigarettes at the age of 50, 60 may still develop lung cancer at the age of 70. So this is the reason why we tell them never to start smoking cigarettes. So that is the second myth or misconception. Third misconception or myth which people have, cigarette users, is when they try to stop smoking cigarettes, I will slowly decrease the number of cigarettes and then stop smoking. So this again has been medically shown that it is not possible, and that people who usually try to decrease the number of cigarettes slowly would never be able to stop smoking. So people who in fact have to stop smoking have to stop all of a sudden. So even if they're taking 10 cigarettes a day, 20 cigarettes a day, the best way to quit smoking is to stop all of a sudden, not to slowly decrease. So this is the third myth, that if we slowly decrease the number of cigarettes, I'll be able to stop comfortably. That has not been proven medically, and in fact people who try to do it will continue smoking a smaller number of cigarettes but will never be able to stop smoking cigarettes. Then the fourth myth or misconception about smoking is, especially in young people who are smoking cigarettes who are in their 20s, 30s or 40s, they will not have symptoms. They'll be healthy, so they will feel that I am okay, my lungs are okay. Sometimes an X-ray may be done, it is normal, a lung function may be normal, but what we have to understand is that the harmful effects of cigarette do not start in the young age. Actually, the harmful effects of cigarette starts after the age of 45-50. So people who smoke cigarette thinking they are actually healthy will eventually develop problems when they are old. So do not presume that because you are healthy now you are safe. So that is another misconception people have, that I am happy, I am healthy, so I am okay with cigarettes. So that is the fourth common misconception people have. Then the last and very important misconception is I have now moved over to using hookahs, or I am trying to get e-cigarettes from outside India and I think they are safe, they don't have the same effects of smoking. Again, this is not correct. Smoking tobacco in any form, cigarettes or e-cigarettes or hookah, has the same medical implications. So the same effects of cigarette will be there in hookah also, will be there in e-cigarette also. It is just the way things are marketed. So all of them are equally harmful. So this is the fifth misconception. So these are the 5 very common things which people have. So just to repeat all these 5 misconceptions, the first thing is safe limit for cigarettes. I am only smoking 1 to 2, I am safe. Again, that is a myth. 2, I have stopped smoking cigarettes, so I should not get any problems because of whatever I smoked in the past. It's not true. The risk will be less, but the risk will be there. Third misconception is I am smoking but I am healthy, so I am okay. Again, that is a misconception. You will develop problems later on in your life. Fourth is I will quit by slowly decreasing the number of cigarettes. Again, that is not going to happen. You have to stop smoking all of a sudden. The last myth and misconception is that hookahs and e-cigarettes are safer than normal cigarettes. Again, that is also a myth, and all of them are equally harmful.